We'll begin today with the Pledge of Allegiance. I
pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Good morning. Welcome to the December 6, 2021 meeting for the Shawnee County Board of County Commissioners. My name is Kevin Cook. I serve as the chair this year, also representing District 2. Joining me this morning is Commissioner Bill Rippon, representing District 1. Good morning.
Good morning.
Commissioner Aaron Mays, representing District 3. Good morning.
Morning.
Madam Clerk, our first item.
First item are proclamations and presentations. A 2021 Community Health Needs Assessment. Craig Barnes, Shawnee County Health Department.
Well, good morning, Commissioners. How are we on this actual frigid December day instead of 70s? I mean, that was nice and everything, but it's starting to feel a little bit more like wintertime around here. Give me a quick moment to get my presentation here pulled up. I've got it here ready, and then we'll get rolling. So here today to provide just a brief overview and talk a little bit of next steps around the completion of the 2021 Community Health Needs Assessment that we were able to complete this year. I know you got a couple of presentations and updates from me as we were going through the perception survey earlier on this calendar year, and then as we finished that and we were going through the secondary analysis and leading up to our large town hall meeting that we held in May. So our steering committee has been hard at work since that. This has been kind of a whole year-long process, if you will, and able to just recently soft release this, but wanted to have an opportunity to present kind of a high-level overview with you today instead of trying to go into each and everything. I know that would be a long process, and I'm sure we don't know everybody's snoring today. So, but we'll go through this a little bit today and give a little bit of data. What I want to do today specifically is talk a little bit about the updates that happened from the 2018 needs assessment into this one, and then talk a little bit about the next steps as we proceed into this. So first off, we do have some guests with us today, and so there's a handful. If I can take a moment, I'd like to have everyone who is part of the steering committee or with HHN go ahead and stand up real quick, and we'll do some quick introductions. We'll start here on the side. This is Virginia Barnes. She's with Blue Cross Blue Shield. She's a past chair of Heartland Healthy Neighborhoods and been very involved in this process. Andy Fry is the chair of our Active Environment and a member of the Complete Streets Advisory Committee and worked a lot on this project and the interventions underneath the Community Health Improvement Plan. Next to him, Brett Martin. He is our current chair of HHN. Major kudos to him for the last 20 plus months. Really have been taking the lead as the chair of HHN and really been the glue that's held the coalition together here throughout the pandemic. Next to him, Savannah Gomer. She's new in her position at Stormont Vale. She's just joined the steering committee, so we've welcomed her and really put her to work right away. So extremely excited to have her join the team and going forward. Carla Hedquist, also with Stormont Vale, part of the needs assessment in the CHIP steering committee and also on HHN leadership, so thank you. Brittany Blattner, she is our epidemiologist there at the health department, so we have not really had a chance to formally introduce her here to the commission yet, as she has been very busy, hunkered down at the health department working on all things COVID, but wanted to make sure we gave an opportunity to introduce her and all the amazing work that she's done for the data analysis as well for this needs assessment. And then Eve Kendall with Department of Corrections. She also serves on our HHN leadership team. And then, well, you know me, you hear from me too much probably for your liking. So, but Craig Barnes, Health Department, member of HHN leadership and the past chair for HHN. So, all right, we're gonna dive on in. So, first off, I think always good thing to start with is what's the purpose of a needs assessment. And so with this, it's really to understand and document the current future community health needs. We do this truly to help us identify and work as a community on what the health-related goals are. We do a exhaustive perception survey, really engaging. I'll talk a little bit more about that, but the community at large. We are very adamant of making sure that we, as the professionals, don't have the perception on what the needs are, that we go to the people and truly get an opportunity to engage them and then understand what they see and what they deal with on a day-to-day basis as what the needs are that we need to address as the stakeholders and the organizations that have some ability to impact some change. From there, just diving a little deeper, the social, economic, and environmental challenges to reaching optimal community health. For us at the health department, it allows us to go after accreditation, and then for our non-for-profit hospitals, it does meet regulatory standards for those health systems. And then the last part there is just to inform the decision-making and the intervention strategies that we do for the Community Health Improvement Plan. So I talked a little bit about the needs assessment, the CHIP steering committee. 3 organizations really make up the lead on that. That's Heartland Healthy Neighborhoods. That's our grassroots community health coalition here in Shawnee County. They are really what we call the kind of the implementation arm of the needs assessment and the CHIP. They will talk a little bit about the structure, but they have the actionable work groups in there that really work on the priority areas that we identify and then develop the strategies around within our Community Health Improvement Plan. Stormontvale Health, that's our not-for-profit hospital healthcare system here in Shawnee County, and then, of course, the Shawnee County Health Department. So, let's start off a little bit of what you've gotten already from me in previous presentations, but talk a little bit about how we did the community, the primary feedback and the data that we got from our community. So, as you see here, we did do a kind of an exhaustive promotion of our perception survey, in which we were able to receive 2,536 responses, which was really, really good, and an improvement from the 2018 survey. We did our promotions both in English and in Spanish. We did get quite a few Spanish survey responses this year, not nearly what we had hoped to reach, and we'll talk a little bit about the demographic breakdown in a little bit, but we wanted to make sure that we tried to engage all segments of our population as much as possible. The next piece that we did for community feedback was to do those 15 targeted roundtables. This is a extreme increase from the past iteration in 2018, where we did 3 neighborhood roundtables in our community, and this time we focused these, multiplied by 5, if you will. And so what we did with this one specifically was target unusual voices or individuals and organizations that may not have been at the table before, and groups that we wanted to engage that maybe have some of the highest health disparities in our community. So again, to make sure that all areas and populations within our community had a voice at the table to provide feedback to us. One of the things, the unique situations for us through this is obviously trying to do all of this during COVID. So I don't know that we all think that our participation was as good as it could have been. We did have 148 attendees, as you see there, through those 15 roundtables, but we did those virtually. So the image you see down there at the bottom was just a screen grab that we grabbed as we led into one of those assessments and roundtables. But what our thought is, as we expand this and continue to get out into our community, that we'll see additional participation. There's other organizations that we already as a steering committee have identified that we want to reach out to, such as like the neighborhood improvement associations, and getting into those areas to really get some good quality feedback from them. The last bullet point here for our community primary feedback was the virtual town hall. So each year, you all are aware that we do kind of at the kind of culmination of National Public Health Week, usually in April. We pushed ours a little bit back this year in hopes that we might see an environment where we could have gotten it in person. We really wanted to try to have an opportunity in person. So we pushed it back to May. And so we did another virtual town hall that we held at the we were going to hold at the library, but we held virtually this year. It's what we usually hold at the library. We talk a little bit about the county health rankings, talk about overview of either the CHIP or the CHAW process that we're in, and then the next steps and opportunities for engagement. So as you see, we had 95 attendees from 45 organizations throughout our community, so great participation again. So what did we see? So from that survey, from that 2,536, the 2,536 participants, we saw this time a more even distribution of respondents across all ages. You can see that top right graph there. The orange is what we saw in 2018, and the blue we saw for this year's response. We were excited to see we got a lot more participation this go around from the seniors. We did do some targeted survey drop-offs and QR codes that we put at the COVID vaccination clinics that we had at Ag Hall and at Stormont Vale. So while people were waiting either in that 15-minute monitoring afterwards or beforehand to get a vaccine, we know we got a lot of good responses through that as well. We also saw an increase in participation from the non-Caucasian populations here in our community, but still not at where we want to be. So what we saw this year was an increase up to about a 6.2% return rate for the African American population, but we know that that makes up about 8.5% of the population, so we know we still have some work to do there to increase the respondents. But we also saw a pretty good increase, 4.9% in the Hispanic Latino, but they do still make up 12.2% of our population. So we've got a lot of work there to do to make sure that their voices are being heard in our community. So one of the other exciting things that we did this year was, well, exciting to me, I guess, was we expanded our community profile. So we saw an updated community profile section where we expand a little bit more around the demographics of our community, the economics, education, and then of course we added this year a COVID-19 section, just a small one for the time being that we will be adding to as we continue to do the monitoring and refreshing of the data for this survey. So likely you'll see from this initial assessment probably a couple of addendums and some further analysis of what we find out of the of COVID-19 and how that has exacerbated some of the disparities that we already see here in our community. One of the other things, and I just took a snip or a snapshot from one of the profiles, this is a school health delivery profile, is we shifted a little bit on what we did for the comparisons. In 2018, we did a comparison amongst 14 counties and then averaged those. To do a little bit more of an accurate comparison, we pared that down to just 4 counties. And so that was Wyandotte County, Douglas County, Leavenworth, and Riley. Those who regionally here close to us or population demographic breakdowns were a little bit more similar to us to give us a little bit more of an accurate comparison from Shawnee County as a whole, then to the state of Kansas and to those counties as well. All right. Any questions on the first part? I don't want to just fly through. Okay.
Good.
So this next piece, I talked a little bit about the community conversation that we did. And we had a great opportunity here to partner with the University of Kansas. And Sarah O'Keefe did a graphic recording. And so this is, can be a little bit difficult to follow, but she did such a fantastic job of capturing all of the discussion that happened over that hour-and-a-half conversation and the different presentations. And so this was, it's on the title page or the cover page of the assessment. It's in there. There's a little bit more of a description, but I did want to share this because I think it shows just how great the discussion was. And so for anybody who was in attendance, I think they would agree. I mean, there was a lot of really good discussion back and forth between stakeholders and the steering committee and then HHN leadership about where we are, where we've been, where we are, and where we're going and the focus. And so that's really helped drive a lot of what we focused on putting into the assessment, and then, as you'll see as we get a little farther down in the presentation, then the prioritization of the issues here in our community. So part of that presentation, Dr. Locke gave a little bit of an early look at the legacy of COVID-19 and how that ultimately will impact health outcomes and disparities in our community. She did this is one slide from a much longer presentation, but I thought it was telling as we talk about, what the impact that COVID-19 had on our community. And I think that there's a lot of, things that we'll still find out from COVID-19 as we look at the data. But one thing that we definitely identified was there were a lot of strong partnerships and collaborations that were started. Sometimes, as I talked about those, unfamiliar voices or those who are underrepresented, being an opportunity to bring those to the table and look at outside the box and creative opportunities to address the pressing issues, whether that be around food security or access to health care or other things in our community. One of the things that we'll be very interested to look at as we continue is what's the ability to be able to impact policies, systems, and environmental changes in our communities to impact those social determinants of health and those three primary risk factors that lead to chronic disease in our community. So, but one thing I think that it'd be remiss if we did not mention, but is what the impact that COVID-19 did have on our community and what that will look like moving forward for our ability to partner and identify interventions to make quality impacts on our community. So, talked a little bit already about 18. I'm going to do a little bit of a past here. So, this was from us in our community, what we looked at in 2018. You'll see the yellow there, the top 6 topics or needs that were identified in our community. That led to the 4 priority areas of mental health, safe access to food, substance use, and health equity that we used to then develop at the time the 2020 to 2022 Community Health Improvement Plan. So, the first health improvement plan that we published for our community was in 2015. We did that on a 5-year cycle. And we learned a lot of things from that publication. And that, in turn, created this updated improvement plan that we published then in late 2019 for the 3-year cycle of 2020 to 2022. So it focused on those 4 priority areas. As you can be fully aware, for the health department, our first meeting on COVID-19 was in mid-January, and then really started having public input and stakeholders that started in February. So right at the beginning that this community health improvement plan was launched, and we began that work. As you well know, a lot of the partners, whether it be from the health department, the hospitals, or even stakeholders across the community, duties shifted a little bit. And so progress on the CHIP was a little slow going there at the front as people were trying to figure out their roles and responsibilities as it related directly to COVID-19. So work is still going, but there were quite a few things to celebrate. Throughout that, one of the exciting things for HHN was we were awarded a $500,000 grant through Blue Cross Blue Shield, the Pathways to Healthy Kansas initiative, that focused on those 3 primary risk factors: physical activity, poor nutrition, tobacco use, that led to the 4 causes of chronic, or 4 leading causes of chronic disease. So that was exciting. There's a lot of work that's happening in that. One of the things that we're getting ready to launch now that we've been able to have some stakeholder meetings is a collaborative around behavioral health. There hasn't really been a coalition with a cross-sectoral partnership from a lot of different sectors in our community to look at the overarching and the root causes of behavioral health, mental health access in our community. So that will be looking excited to hopefully be announcing to you all the launch of that coalition at the beginning of 2022, as well as an STI collaborative. One of the things that we identified through our work, especially on the health equity side, is the disproportionate impacts sexually transmitted infections have on certain populations within our community. So we're excited to also be pulling together a collaborative that will really be looking at that and be able to help us develop some quality interventions to move the needle on that number as well. A couple of other things, we've had the Racial Equity Impact Analysis Group that's been really looking at the social determinants of health and then through policy and system change. One of the things that they're working on right now is a resolution proclamation of racism as a public health crisis. And so there's been a lot of work around that statewide as well as nationwide. And so that group is looking at that on the equity spectrum. The substance use priority area, PARS, Prevention and Resiliency Services, was awarded an opiate prevention and education grant through KDHE, so looking at prescription drug misuse. We have the drug take-back days that are ongoing, and then a lot of alcohol and tobacco education and prevention focusing on vaping and education within the school settings. So that's been exciting. And then in food security, this is one of the areas that through COVID we identified, where COVID exacerbated the long-standing issues. And so through that, and you guys have an appointment. We have an appointment to our Farm and Food Advisory Council back here, Bill Sutton. And so we formed that, and you guys took some ownership in that and appointed a member to represent the county on that. And this is the group that's looking at, and right now is conducting a more comprehensive food system assessment to look at the issues here and then help us develop recommendations through policy systems and environmental changes to impact food security here in Shawnee County. We've seen the development of a food resources map through K-State Research and Extension. Topeka Rescue Mission's Operation Food Secure worked really well to distribute boxes of fresh, healthy food to those in need in our community. And those were items and interventions that were done that were really well needed in our community over the last 20-plus months. So a couple of things to obviously celebrate. So this is the structure of the work groups that are underneath HHN. The X's are the groups that kind of were either put on pause or did not actively meet. We talked about the Behavioral Health Collaborative and the STI Collaborative. The Health Equity, it's kind of spun off into some different areas. The United Way of Greater Topeka put together a COVID-19 care resource and coordination group that brought together a lot of the partners that were typically meeting there in Health Equity to look at some of the new indicators and things that were happening around COVID-19 and how to address those in our community. So that work group itself wasn't actively meeting, but it was really meeting in other ways. And then the Active Environment Group, similarly, a lot of the members were also still meeting as part of the Complete Streets Advisory Committee. And so they were working through that avenue on the areas of the physical environment and physical activity in our community. So back to this assessment. So what we did when we looked at the primary was we developed through the two questions, what were some of the biggest opportunities and then what were the concerns for our community. And then as we tabulated all of that data, we were able to rank that. And you'll notice a lot of similarities, right, from 2018 to 2021. So what we took that a little bit further, and then we looked at this and the correlation then of that with what was considered the biggest problems. So we're looking at groups that had that higher than 30%. Where individuals then listed that there were no services in those areas, so numbers that were higher than 5%, and then, or if there were services, that the quality then in our community was considered unacceptable by those participants, those 2,536 respondents we had for the perception survey. So from there, again, you'll see then in the yellow highlighted areas, again, a lot of similarities between 2018 and 2021. And so the four major areas of work are going to continue to be the same as we look at moving forward on our next community health improvement plan. So those again will be the mental or behavioral health, healthy eating and obesity, substance abuse, and then equitable access. One of the things that as a steering committee that we'll be really diligently working on this year is kind of an addendum to the community health improvement plan. I think, as we all know, it's hard work and it takes time to see sometimes the numbers reflect interventions that are put in place. And so, we never truly expect to see a massive overhaul from one improvement plan to the next, from one needs assessment to the next. But knowing that this kind of iteration of how we've been doing the needs assessment really started in earnest in 2018, we're hoping that through this iteration, this needs assessment, the next update to the CHIP, this is where we're going to start seeing some quality changes in the numbers, or at least some shifts in where we'll be working on. So that's what we're excited to see as we really start diving into the work. And as COVID hopefully starts winding down, the ability to re-engage with a lot of those community stakeholders and start working in earnest on some of these pressing issues. So from there, as we identified through the primary data, then what the community perceived as the issues and did some prioritization as a steering committee, that led us into then the next step of the needs assessment. And that was the secondary data collection and then the analysis of that data. So what we started doing there was looking at those priority areas and then looking out into the community and then at state level data, county level data, and trying to find data sources that in turn reflected the priorities in our community, so that we at least then had some data that we could then prioritize and then provide also to our community and our stakeholders. Our goal with the needs assessment is to not create an assessment that is just printed as a plan and then sits on a shelf. We want this to become it's going to be a living and breathing document. So one of the things that we're going to be big on this time through this 3-year cycle of the needs assessment is a little bit more robust monitoring and refreshing of data, more stakeholder engagement and focus groups throughout that 3-year cycle to kind of see, because sometimes the data lags and takes some time to catch up. And so one of the things that we want to see too is to get that primary data as well from our stakeholders to see if an intervention that we have implemented has made an impact, whether or not in that section of our community or with that population group that maybe is disproportionately impacted by a specific indicator, and provide more kind of addendums and updates and data that are useful then to our community partners to further their work either through grants or strategic planning, and looking forward to leverage then that capacity across multiple sectors to then impact change in our community. So what you see here on the right is just, again, a small snippet from the data itself. One section, this was just a little bit of an overview then of those county health rankings, specific the outcomes and the health factors, and then a comparison for Shawnee County to that state of Kansas, and then to that 4-county average. All right. So there's a lot of data. Like I said at the very beginning, I didn't want to go piece by piece through all of that. Otherwise, I'd be up here a lot longer than I already have been. So the next piece, as always, is what's the call to action, right? And what are the next steps? So what we will be doing following this presentation here is we will be pushing out a media release to really formally announce the publication of the needs assessment. It has been published to the Health Department's webpage, to Stormont Vale's webpage as already, and then we'll be sharing those access points also through our social media platforms. What we're asking then also back from the community is some additional feedback. You know, what's missing from the needs assessment? What are the things that we can provide moving forward? Is it a representation of the needs of our community? So we already did that in the perception survey, but now we have actually formally published a document. And so I have the link here available because I know this will kind of go into the minutes later, but we'll be sharing that through the media release and then online through our social media platforms as well. And so encouraging the public to take an opportunity to, I know it's a lengthy document, but maybe even take a look at the highlighted portions and even the priority areas, and to give us some feedback that we can move forward on as we go into 2022 if there's things that we can improve upon. Because everything is, everything that's done is not done 100% perfectly, right? There's always areas for evolution and to improve upon. And so we want to make sure that we're improving on the areas that the public thinks it's important. The next step here is the re-engagement of HHN work groups. So as I mentioned, Brett Martin here in the back is the chair of HHN at this moment. And so we're encouraging organizations, partners, stakeholder groups to reach out to Brett. They can reach out to me as well, and let us know what your interests are. Likely there is a work group out there or a coalition that is working on these issues. Let's get you engaged. Let's hear your voice. Let's bring it to the table. Because only once when we can get a good quality representation from our community can we really make some actionable change in our community. So like I said, additional stakeholder meetings, I've kind of talked about this throughout the presentation. That's one of the big keys from our steering committee moving forward, is to looking at re-engagement, not just during the needs assessment publication cycle, but engaging those partners and those organizations throughout the entirety of that 3-year cycle where that data is meant to inform decision making. And so our goal is, because as we know, needs change, priorities shift. And so our goal is to engage those stakeholders continuously through this process moving forward, and then also in the development of those CHIP interventions. So we ensure that we're providing a strategic plan for our community to impact health that is correct, adequate, and is useful. Again, something that's not just created and then sits on a shelf, but something that is actionable on a living and breathing document. So that kind of segues perfectly into the third bullet point there. That's the action planning. So our steering committee actually met last week, to look at the 2022 plan and to develop some timelines on how we want that to look like, to look through the needs assessment and the prioritization. And then we've already started reaching out to partners in those priority areas to kind of first off kind of get an idea of what has been happening, in the last 20 plus months while the pandemic has been going on that we may not or be aware of, or to learn a little bit more about those initiatives that we are aware of and what we can do as technical assistants, as a steering committee, as a health department, as a health system in our community to leverage resources and capacity to improve health. So that will be going on. You'll get to see me or another representative from HHN leadership present probably most likely on that CHIP update as we move forward through 2022 as well. And then the fourth point there, again, as I've kind of alluded to already, one of the things that's, really reached to the top of our steering committee this year is that continual monitoring and refreshing of the data. Data shifts each year, and so we want to make sure that we're providing additional analysis to you all as the Board of County Commissioners, who also serves as the Board of Health in our community, but then all of the rest of the stakeholders, so they have something that they can use, like I've mentioned, in grant applications for updates to their strategic plan or the development and formation of new groups around those priority areas. And then lastly, look forward to our next needs assessment that we'll be doing in 2024. So, fun times, right? Yes. Right? Come on. Yes, all right.
Commissioner Mays, thoughts?
Questions, thoughts, yes.
Yeah, it's a lot to take in. Thanks, Brad.
Yeah.
Commissioner Rippon?
Nothing.
Brett, do you want to come talk to us just for a little bit about how people might engage with HHN and healthy neighborhoods as we move forward with the Community Health Improvement Plan?
Good morning. Thank you, Commissioners. Yeah, so lots of opportunity for folks to be able to engage through the work groups, as Craig said. Some of those groups met regularly through COVID, but oftentimes they met in different settings with different opportunities. The ways in which folks can engage there is they can email me. My email address will be in the press release, but it's also here. And they can engage with me, have some conversation about where they might find a place to fit. We have some opportunities to be able to expand those work groups moving forward. So we've got just a few. We've got those folks who are working in the Healthy Babies work group, those in the Active Living work group that was mentioned before, folks working in the racial equity analysis group, the sexual health collaborative, as well as the behavioral health collaborative. And so lots of opportunities for folks to be able to do that. As Craig mentioned, we also have the Pathways Grant and have some opportunities through the Pathways Grant to perhaps create a couple of other work groups. So lots of opportunity there. Folks can email me. We can have some conversations and find a place for them to fit.
If people have maybe some thoughts or questions about it, how often would a work group meet?
Yeah, so the work groups typically meet monthly. They meet anywhere from sort of an hour to an hour and 15 minutes. And we have some that meet at sort of on a regular cadence during the month, and other times they send out doodle polls and are a little more flexible in that way. But yeah, roughly about an hour a month. And then sometimes there's work certainly outside that, folks doing research or different types of follow-up.
Okay. Questions for Mr. Martin? All right. Thank you very much.
Thank you.
One thing just to quickly add too, so as part of Heartland Healthy Neighborhoods, next Monday, so a week from today, will be our annual end of the year meeting. So this is actually a great opportunity for anybody who may be interested in learning more about what the work groups have been doing. So we'll be getting kind of report outs from those work groups, and then kind of like I mentioned on our last slide, that kind of call to action as we look forward into 2022 and the work that will continue during that time. So we encourage anybody to attend. Brett, correct me if I'm wrong, but that will be a virtual meeting. Yep. So we'll be a virtual meeting. We'll get that meeting information out as soon as possible. So, all right.
I do want to take a moment and thank Blue Cross Blue Shield for your grant and your ability to help fund some of the offset of the cost of this. Thank you for what you've done in the community. Also to Stormont, KU Ardent, and all the work of everyone that's involved, and Craig, you and your office with Shawnee County. So. Thank you.
Thank you very much,
Continue to do the work.
Commissioners. Appreciate your support.
Madam Clerk, our next item.
Item 3, consent agenda.
There are a number of items on the consent agenda. Are there any questions, or is there a motion?
I'll move to approve.
Motion to approve by Commissioner Mays.
Second.
Second by Commissioner Rippon. All in favor, say aye. All opposed? Passes 3-0. Our next item.
Item 4, new business. A, County Clerk, number 1, consider all voucher payments.
Commissioners, this morning we have vouchers totaling $772,834.95. Two items to note on there. One is under Public Works to Bettis Asphalt and Construction for $143,202.72. It's for South Topeka Boulevard, the removal of the tracks. And then under Asset Management for Parks to Allen Herschel Company for $5,133. It's for mini train parts. I don't have any questions about any of this. If you don't, I will move for approval.
There's been a motion to approve by Commissioner Mays. Second by Commissioner Rippon. All in favor, say aye. All opposed? Reflected, it passes 3-0. Our next item.
Item A2, consider correction orders.
I'll move for approval.
Second.
Motion to approve by Commissioner Cook, second by Commissioner Rippon. All in favor, say aye. All opposed? Reflected, it passes 3-0. Our next item.
Item B, Register of Deeds, number 1, consider approval of request to create and fill a record specialist position at a cost of $53,626.26, including benefits, with funding allocated in the 2022 departmental budget, and to fill any subsequent position which may become vacant from filling this one.
Good morning, Commissioners. Becky Neosi, Register of Deeds. First of all, just want to thank you for funding this new position for my 2022 budget. This position will be responsible for recording documents in our office, and this is due to the increase in real estate activity. I ran a report, we had 7,000 more documents last year than we did in the prior year, and brought in $400,000 in filing fees in revenue for the general fund. So this position is needed, and I just want to thank Michael Augustine and Angela Lewis in the Human Resources Department for helping me create this position. So any questions?
Questions for Becky or about this position?
I move for approval.
Second.
Motion to approve by Commissioner Rippon, second by Commissioner Mays. All in favor, say aye. All opposed? Reflected, it passes 3-0. Thank you very much, Becky.
Thank you.
Our next item.
Item C, Audit Finance, number 1, consider the allocation of the 2022 Transient Guest Tax to Stormont Vale Event Center for an amount of approximately $60,000.
Good morning, Betty Greiner, Director of Administrative Services. It's that time of year again to come to you for the Transient Guest Tax for 2022. Shawnee County receives 7% transient guest tax from the one hotel that's located in the unincorporated area of Shawnee County. 1% of that is already designated for Sunflower Soccer Association. So then the remaining 6% is up to you as a commission to appropriate. The resolution says that it is to be used to promote conventions, tourism, or economic welfare of the county. This year, I expect the transient guest tax to total about $60,000. So that means $8,500 of that approximately would go to Sunflower Soccer, and then about $51,500 is available for you to appropriate. This year, I have received only one request for these funds, and that is from Stormont Vale Event Center. And Kellen is here and would be happy to tell you how he plans to use those funds.
Kellen?
Good morning, Commissioners. Kellen Seitz, Spectre Venue Management, Stormont Vale Event Center. The funds that we request out of the transient guest tax revenues primarily go towards conventions that we use for our convention sales department and or myself to elicit and solicit business for the event center at Stormont Vale Event Center. So those can be anything from conferences and conventions trying to get live entertainment. Those can be anything from conventions with that we partner with Visit Topeka, engaging in youth sports activities, large national and or regional convention type business to come to the state of Kansas, and certainly business within the own state, within our own state of Kansas, to hold their events and participation at the event center.
Kellen, prior to the renovation of the Stormont Vale Event Center, we had watched as our conventions were declining, and then with COVID, really no conventions were occurring.
Yeah.
So as we come out of a renovated campus, what are you seeing as far as conventions?
Yeah, so some of those conventions are still in a holding pattern. I think we've seen that over the past 18 to 20 months that some have developed and started to bring those back. Some are still kind of holding off and waiting. We have picked up a few new pieces of convention business. I think the really exciting piece is the live entertainment side. We've been fortunate to gain some additional live entertainment content, some of that through the relationships and the partnerships that we make at some of the conferences and conventions that I go to try and secure that business for our facility, but Topeka and Shawnee County as well. I think we'll start to see those picking back up, or at least we've anticipated and budgeted for those conventions to pick back up starting in 2022. Time will tell. Time will tell.
Questions for Kellen? Good. At this time, Betty, I make a motion to allocate the 2022 transient guest tax with 1% going to the Sunflower Soccer Association, and then the 6% remaining to go to the Stormont Vale Event Center, with that being under Spectra. Okay, that would be a motion made. Is there a second? Motion made by Commissioner Cook, second by Commissioner Mays. All in favor say aye. All opposed? Reflected, it passes 3-0. Thank you. Thank you, Kellen. Our next item.
Item D, Department of Corrections, number 1, consider authorization and execution of contract C454-2021 with Community Solutions, Inc. for quality assurance technical assistance with adult community corrections assessments at a cost not to exceed $10,000 to be paid from state grant funds and the departmental fiscal year 2022 budget funds.
Good morning, Commissioners. Tim Phelps, Department of Corrections. This item is on the heels of a technical assistance grant that was given us by the Kansas Department of Corrections that allowed us to spend 2 years with this company training up all of our ISP staff so that when they conduct assessments on their offenders, they're doing it true to form as it was designed to be done, and that they are all doing it equally so that you have good inter-rater reliability, so that the assessments are accurate. And that's the key of our work. That's the key component of the job that we do over there. So we've had great success in the development of the staff, and now what we're wanting to do is continue our relationship with this company so that we can not lose ground, and we can develop some of our own internal staff to becoming quality assurance monitors and move this progress forward. So that's the purpose of this agreement. And it'll only be spent to the extent we use it up to the roof or the ceiling of $10,000.
Question?
Nope. I'll move for approval.
Second. Motion for approval by Commissioner Mays, second by Commissioner Cook. All in favor say aye. All opposed? Reflected, it passes 3-0. Our next item.
Item D2, consider authorization and execution of contract C455-2021 with Community Solutions, Inc. for quality assurance technical assistance with juvenile community corrections assessment at a cost not to exceed $30,000 to be paid from the state grant funds, and no Shawnee County funds will be utilized.
Again, Tim Phelps, Department of Corrections. This, the one thing I didn't like about what KDOC did is that they did not include juvenile ISP staff in that technical assistance grant. But we want to have the same success on their side of our operation. So I received some additional grant funds from KDOC Juvenile Services, and I want to use those to bring all of them up to the same level of proficiency that we've seen in the adult staff. And we're hopeful that that will then be able to be continued like we're doing on the adult side. And that's what this item is about. And there's no county funds being used for this purpose.
Questions? I'll move for approval.
Second.
Motion to approve by Commissioner Cook, second by Commissioner Rippon. All in favor, say aye. All opposed? Reflect that it passes 3-0. Thank you.
Thank you, Commissioner.
Our next item.
Item E, Appraiser's Office, number 1, considered authorization and execution of contract C-456-2021 with Enterprise Fleet Management for the lease of two 2022 Ford F-150s, with the equity from the two trucks being replaced used to offset the cost of leasing the new trucks, funding to be paid through the Land Records Fund.
Good morning, Steve Bauman, County Appraiser. Conversations with Brent Holsether, our fleet manager with Parks and Rec, indicated that now is the time to strike with the used truck market being so hot that we actually have a very good chance of reducing our lease payment by trading up 2 years newer in our trucks. So this is a request to do that. In doing so, he's estimating that we can save about $50 a month per truck on our lease payment, our current lease payment. That's not a reduced price from the new lease. It's from what we're paying right now. So it only makes sense to go ahead and do it. And again, I'd like to thank Becky Neosi for her funding of our leased vehicles. Be happy to answer any questions.
Questions?
Yep. I'll move for approval.
Second.
Motion to approve by Commissioner Mays, second by Commissioner Rippon. All in favor, say aye. All opposed? Reflect that it passes 3-0. Our next item.
Item F, Parks and Recreation, number 1, consider approval of request to award bid to CBS Manhattan LLC for the monitoring of intrusion alarm systems, including the optional upgrade of existing hardware for cellular monitoring and remote programming for a total of 42 locations at a cost of $17,640 per year, utilizing the Building Maintenance 3R Fund, and authorization and execution of contract C-457-2021, a month-to-month agreement for same.
Good morning, Commissioners. Randy Luby, Parks and Recreation. If you recall, back in September, you gave us approval to go out for the monitoring of the alarm systems, which included an option to upgrade our hardware for cellular and remote programming. As the clerk mentioned, this is for 42 locations, and it is $17,640 per year for the monitoring. There was a little correction. That does come out of our operations budget, not our 3R budget. The actual upgrades will cost $36,292. It's explained in our memo. Those upgrades would include for the cellular devices and for allowing remote programming. By doing that, we are eliminating 24 phone lines, which is a savings of about $28,000 per year on phone lines. I do have Park Police Chief Mike Cope. He was the one that headed up this RFP. To stand for any questions you may have.
Questions for Randy or Chief Cope regarding the monitoring contract?
You said the fundings were coming from where now? It wasn't-
The yearly funding is coming from our operations, the $17,640. The one-time fee is coming from for the upgrades is coming out of our 3R Park Maintenance Fund.
I see.
Any other questions?
No.
Is there a motion?
I'll move to approve.
Motion to approve by Commissioner Mays,
I'll second.
second by Commissioner Rippon. All in favor, say aye. All opposed? Reflect that it passes 3-0.
Thank you.
Our next item.
Item F2, consider approval of request to solicit bids and/or proposals for the purchase of supplies and equipment necessary for the operation of programs and facilities in 2022.
Good morning, Commissioners. Randy Luby again with Parks and Recreation. This is our annual request to go out for all our seasonal supplies that we may need throughout the spring and summer. We've been doing this for the past several years. We still will come down before you to sign any contracts that need to be signed, but some of these requests would be for grass seed, fertilizer, picnic table, signage, those type of things. Be glad to answer any questions you may have.
Questions?
I'll move for approval.
Motion to approve by Commissioner Rippon,
Second.
second by Commissioner Mays. All in favor, say aye. All opposed? Reflect that it passes 3-0. Thank you, Randy.
Thank you, Commissioner.
Our next item.
Item 5, administrative communications.
This is an opportunity for any department head or member of the public to address the commission on any item. No questions. All right. Commissioner Rippon.
Well, I, as well as I think the rest of you, attended the Christmas parade, and Saturday. It was well attended, and it was great. Good weather, and I think everybody enjoyed it. Good to see everybody out.
A lot warmer than it was this morning.
Yes, it was.
Commissioner Mays?
Nothing for me. Well, I guess 45th Street's reopened now, and we'll be doing a ribbon cutting there. Is it
Wednesday?
Wednesday?
Thursday.
Thursday, okay. Thursday. It's on the calendar. I'm looking forward to it.
We do have a JADO meeting on Wednesday. Just might note that's the last one of the year. So, Madam Clerk, our next one.
Item 6, executive session.
There is a need for an executive session. It will be for personnel matters of non-elected personnel and matters relating to the employee or employee negotiations, whether or not in consultation with representatives or representative of the body or agency, consultation with the attorney for the body or agency, which will be deemed privileged in the attorney-client relationship, and this is regarding the implementation of the evergreen compensation study for a period not to exceed 30 minutes, starting at 10 o'clock. No action is anticipated. Is there a second?
Second.
Motion made by Commissioner Cook, second by Commissioner Rippon. All in favor, say aye. All opposed? Reflect that we are going into executive session to come out at approximately 10:30. Again, no action is anticipated. Passes 3-0. All right.
You got two.
We are back from executive session. No action was taken. We are adjourned.